Hello, DS here, founder owner Greenwood Dental. Welcome back to another video. Today I would like to explain the difference between osteoporosis and osteopetrosis and why is that important for us to understand as far as the mouth is concerned. Osteoporosis is a very common term a lot of us heard about and a lot of us hear from our advanced years family members, the seniors. And osteoporosis is the loss of bone all around pretty much the body. And that's when certain patients are required to get bone density imaging or bone density test to determine the progression of the osteoporosis or the loss of bone. These condition or that condition, osteoporosis, is very common in a very petite, small framed, especially females. We don't see it that much in males because obviously most of the male structure is all about producing bone and growth. And I've touched base on that in my video where I explain the baby's first visit and the difference between the growth, boys and girls, as far as my observation data. And again, 23 years of seeing thousands of patients, you get to form your understanding of what's going on beyond textbook. So it's small framed, mostly female, mostly blonde, blue eyes females. And that comes from the Nordic genes that descended to many countries. So osteoporosis is the loss of bone. Osteopetrosis is the depositing of bone. Now, the interesting thing about both conditions, so one you lose bone and the other one you start adding bone for no reason whatsoever. The only thing that I understood from reading about it, it's all genetically related. So osteopetrosis is you depositing a lot of bone. Now, one could think that depositing a lot of bone could be a good thing. Yes, I want more bone. Thicker bone is healthier. Thicker bone is better. Thicker bone is stronger. But unfortunately, that's not the case. What the studies have found that osteopetrosis, overproducing bone all over your body, that at some point makes the bone more brittle and puts the patient in a higher risk of fracture. I just had a case the other day. A patient had what we call tori in the mouth, which is the osteopetrosis, the oral osteopetrosis version of it, where patients deposit a lot of bone in the mouth and they have those bulbous bones, especially on the floor, in the floor of the mouth. And refer to my tori video on YouTube. I spoke about that. But in that case, the patient is depositing so much bone that the bone actually penetrating out of the tissue. And if you look in his mouth, you'll see a big chunk mass of bone that's sticking out of the jaw. It looks like a sea coral. You know, the coral that you find in the oceans? That's what it looks like. It looks like a seashell in there. It's very painful. And as the bone continues to grow, again, the bone becomes very brittle, and it has higher risk of fracture. What to do about it? Definitely cases like that, we'll send to an oral surgeon. They'll get you numb. They have to shave all that bone. Would that make the bone stop growing again? Not necessarily. It might regrow again, but maybe in a slower pace and less aggressive than the first time. Now, some people will ask that, is that cancer? Again, when we send you to the oral surgeon to get a biopsy, they will send it to a pathology lab, and the pathology lab will run the test. Then we can find out if it's malignant or benign or just bone growth. So that's very important to know and very important to remember in order to catch the condition as soon as possible before it turns into more malignant and more of a chronic condition that it has to be treated in a different way than just shaving it and letting the area heal. I hope that answers some of the questions that I have been getting about the bumps in your mouth. But again, please refer to my tori video. I speak about it in detail. That's it for today. We love you, be safe, and I wish you a happy dental health. DS out.